Good evening, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. I see a lot of people have signed up for tonight, and I see a lot of common names that I have seen before, but I also see some new names on the list of people that I know that are participating. So, first of all, to those of you that are coming back again, welcome back. Glad to see some familiar names. And to those of you that are new here, I hope that we can help you learn something about Lyme disease, something that will help move your treatment forward to. So the way that these webinars work, you create them. Every week's a little bit different because it all depends on what questions you ask me. So the way to do that is to ask questions, and you can do that by looking over here on the right-hand side of your screen at the bottom. There's a chat box. Go ahead and write your question to me through there. As you're writing your question, do not hit the enter key. Don't try to create paragraphs. What happens if you hit the enter key, it completes the question and sends it to me. So if you're trying to write a question, hit the enter key multiple times, that means it breaks it into many parts that get to be hard for me to follow on my side of the screen here, okay? So try to hit the enter key only one time is what I ask on that. I am creating a recording of tonight's webinar, and you will get an email from me sometime around 8:30. Yeah, that works about. Actually, yeah, probably around 8:30 a.m. Central Standard Time tomorrow morning. You should see that in your email. Through that, you'll be able to click on links to see the recording, but also you'll be able to sign up for the next webinar. And just so that everyone knows, I'm not actually going to have a webinar next week. I'm actually traveling next week, but the week after I will. So in tomorrow's email, when you get the sign up, it will be for 2 Thursdays from now, okay? So it won't be for the following week. Let's see here. What else do I need to say? Oh, during the webinar tonight, I will post your question on the screen. All right, so everyone can see it. But in the recorded versions of the webinar, no one is able to see those. They don't show up. So I will be reading the questions out loud too. So I apologize for the longer questions. That may get to be hard to follow if you're listening to a recorded version, but I'll try to be as succinct as possible as I read those. Finally, if you do not get the email tomorrow morning, there's a number of places that I do post the webinar recording. One is on my Facebook page, which is facebook.com/treatlyme. Okay. You can also find it on the homepage of Treat Lyme by Marty Ross MD. You can also find it on the webinars page there. And finally, you can find it at the bottom of the homepage at my supplement store, which is Marty Ross MD Supplements. Okay, so there's multiple places that you can find a copy of the recording from tonight. All right, so let's go ahead and get started here. All right, first question is from Bill. Hi, Bill. Let's see. Hi, Dr. Ross. I have been treating Borrelia Bartonella mycoplasma over the last 2 years with protocols of doxycycline, minocycline, rifampin, amoxicillin, and azithromycin. Monitoring response with Armin Labs ELISpot test. Have had significant improvement. I could hardly walk a year ago because of the knee pain. They are pain-free now, and the ELISpots are negative. However, I have recrudescence of one of them. With the ELISpot still negative, we need to go by clinical signs to get an idea of what protocol to use this round. Current signs are pain in both hamstring tendons, intermittent cardiac arrhythmias, burning sensation in my feet, poor memory and brain fog, nail bed dystrophy in my thumbs, and did recently have the Bartonella type rash on my abdomen, get the odd acute 24-hour flare and ligament in any joint. Just would like your thoughts if you think would be targeting Bartonella this round. Thanks. Bill, that's a good question. So first of all, many of you may be familiar with the ELISpot test. It's a test run by Armin Labs, and there's a couple other labs doing it now too. But what an ELISpot test does is it looks to see that we draw your blood and we pull out a type of white blood cell called a T cell. T cells are the kind of cells that fight viral infections, but they also fight bacterial infections too, okay, including the Lyme infections and the co-infections, all right? So what we do is we pull those T cells out and we take proteins from the germ we're trying to see if the T cell, to see if you have that infection. And if your T cells have tried to fight that infection recently, they will make a bunch of cytokines and we can measure that, okay? So for instance, to see if you have Bartonella, we would take Bartonella proteins introduce them into a test tube that has your T cells in it, and then measure, do your T cells make cytokines showing that they have reacted to Bartonella in the past, okay? Now, there are some limitations to that test. First of all, T cells have the kind of T cells that are being measured have a lifespan in you of 2 months. So when a test comes back positive, that means that that germ has been active in you sometime over the last 2 months, okay? The problem in trying to use it to measure whether you're done with Lyme, the Lyme germ, not Bartonella, not Babesia, but the Lyme germ, is Lyme hides in you. And so even if a ELISpot test comes back negative for the Lyme germ, that doesn't necessarily mean the germ is gone, okay? Also, the ELISpot test can be wrong about 15% of the time. It will miss if you have an infection in you 15% of the time. That's what the studies tell us, okay? So sometimes we just have to go by what the clinical symptoms tell us, which is what you are talking about doing here. So in terms of what would your clinical symptoms suggest to me, the poor memory, the brain fog, burning sensation, which is a neurologic injury kind of sensation, pain in the tendons and the ligaments, and the Bartonella type rash suggests to me Bartonella, okay? I will also tell you though, I can't exclude that there is Lyme in this mix as well too. And as I just said, the ELISpot test is not necessarily a good way of determining if Lyme is out of you because Lyme hides. So if I were treating you, if I had a patient that came in with these kind of symptoms, I would choose antibiotics that treat both Lyme and Bartonella, okay? And I would try to design something that would cover the various forms of the Lyme germ as well as Bartonella. What works best for Bartonella are antibiotics that are called intracellular antibiotics, antibiotics that get inside of cells, okay? So in terms of then considering about the Lyme germ at the same time too, remember Lyme lives as a spirochete, that's the corkscrew looking thing, okay? Lyme also has a form of the germ which is called a cyst form, or some people call that the L form. Anyhow, it goes by different, it's called a round body sometimes too, but I'll call it a cyst form, okay? So you have to cover for spirochete and for the cyst form. In addition, when you're choosing antibiotics for Lyme, you've got to cover for Lyme that lives inside of cells, that's intracellular, and outside of cells, okay? All right, so what you could do, the best treatments for Bartonella have at least 2 intracellular antibiotics, sometimes 3 intracellular antibiotics, okay? Of those various intracellular antibiotics that are good for Bartonella and for Lyme, one of them, or 2, one is rifampin, the other one is in the same family, it's called rifabutin. Rifampin or rifabutin also treat the cyst form of the Lyme germ, okay? So one of the things you want to do with your treatment is probably choose a rifampin or a rifabutin. All right, that's what I would do with the patient if I was treating somebody, that would do that, okay? I would then try to couple it with another intracellular antibiotic, and for that I might do an azithromycin, which is Zithromax. I might do a clarithromycin. I might do a doxycycline. I might do a minocycline, okay? If you want to go 3 antibiotics, you could do a tetracycline, which is a doxycycline, minocycline, along with the macrolide, which is a zithromycin or Biaxin, along with the rifampin, all right, or rifabutin. That would give you 3 drugs, okay? But yeah, I would cover at minimum, I mean, what your symptoms suggest to me, and again, this is just based on what you're telling me, is that Bartonella is likely here. The reason I'm wondering about Lyme is the arrhythmias and also the tendinitis aspects as well here too. So it makes me wonder, okay? All right. Bill, I hope that gives you some insights, and good luck and working with your physician on this, okay? All right. Hello, Holly. Let's see. What can you tell us about burning, itching symptoms and any relationship to Lyme and co-infections? I have experienced these sensations on my extremities, in my mouth, and currently in my back. I'm also positive for mold, so between Lyme and mast cell, I'm trying to hone in on the cause and how to treat. Okay. So itching, just the itching part. If you're describing itching, I'm either thinking of neuropathy, nerve injury giving itching, that's called neurodermatitis, okay? Or sometimes itching can be due to very dry skin, all right? Now, I don't think you have dry skin in your mouth, but I'm talking about other areas of the body. So one thing to be sure of that I usually recommend for my patients when they would come to see me if they had these kind of the itching symptom is I'd look at their skin. And if their skin was very dry, I would suggest using moisturizing creams, okay? So things like Eucerin cream, for instance, can be very useful at getting the skin moisturized, and sometimes that can really help with the itching side of things, okay? But when you couple itching with burning, that suggests more neurologic cause of both the itching and the burning, okay? So those are neuropathy symptoms or nerve injury symptoms, okay? And in Lyme, we know, for instance, with various symptoms of Lyme, like joint pain, muscle pain, and even neuropathy, that the symptoms can wander around. All right, they'll be here one time, then they'll be in that part of the body, then they'll be over in that part of the body. So the wandering nature of this sounds like a Lyme symptom. Okay, so something is injuring your nerves. All right, so what could be doing that? Well, mold toxicity can. That can be a toxin to nerves. Lyme infection can, Bartonella can. So it's either infections or mold or the combination of all the above, okay? So in working with your physician, you're going to need to address how to get those mold toxins out and figure out which germs you should treat. Do you have Lyme? Do you have Bartonella in you? And should you treat those, okay? In addition to that, though, there are some things that you can do that are supportive of the nerves, that help nerves heal, that repair injured nerves, okay? One of those that I have found helpful in my practice is to use glutathione. So glutathione is a very powerful antioxidant that is made in every cells. And one of its purposes is to repair injury to the cells. Okay, so I call it the great fixer. It's the master reparative, restorative antioxidant that is found in every cell. Now, if your nerve cells are injured, they may have tried to repair themselves and have exhausted their glutathione gas tank, okay? So one of the cornerstones that I would do with somebody with neuropathy is to get a person started on glutathione. My preference would be to use what is known as a liposomal glutathione. That means it's a glutathione that's microscopically wrapped in fat. The reason to do that is glutathione can be really destroyed quite easily in the stomach. But if you wrap it microscopically in fat, that helps get it into the small intestines where it can be absorbed better, okay? So one of the products that I have found useful, and I actually have studies that show that they do increase levels of glutathione inside red blood cells, that's what they measured, is Research Nutritionals, their product called Tri-Fortify, either orange or watermelon. It's just flavored differently, okay? But they have some science that shows that at least it does increase glutathione inside of red blood cells. That means it probably is absorbed very well, okay? And the way you would use, if you use the Tri-Fortify product, you want to take 5 milliliters 1 or 2 times a day, okay? Second thing that I would always do if I had somebody that had nerve injury is to repair the cell membrane, right? So your cell membrane, nerve cell membrane, any cell in the body actually, the membrane covering is made up of a double layer of fat. And that double layer of fat can get injured by these toxins. It can get injured by Lyme. It can get injured by Bartonella. That's probably more of an indirect injury, and that is when the body's fighting those infections, it produces a bunch of oxidizing agents that can damage the fat cell membrane, okay? So you want to repair that too. And so one of the things that can repair that is to take the fats that make up the cell membrane, all right? And so one product that has those fats in it is a product called NT Factor. Research Nutritionals has a product called NT Factor Energy that has NT Factor in it. And if I were to use that product that has the NT Factor, and the NT Factor, again, I think supports the nerve cell membranes to repair those nerve cell membranes from the outside, okay, you would do 2 pills 3 times a day for 2 months and then decrease it down to 1 pill 3 times a day for 4 months, okay? So those are ways to support your nerve injury recovery, okay? So basically the glutathione is working from the inside to support fixing those nerve cells, and then the NT factor, phospholipid, fats is working at the cell membrane on the outside. All right, so it's an inside-outside treatment, basically. All right, those are some thoughts for you. Okay, but also just check to make sure you don't have dry skin. That's something I have found very helpful in my practice in Seattle when I was there. Okay, all right. Thanks, Holly. Good luck to you. I want to do a quick screen share here just to show you if you're ever trying to figure out what things are. One of the things you can do is take a look at my site, which is Treat Lyme, okay? And this is it. And so in terms of the things I was just talking with you about nerve repair and neuropathy, take a look at if you want to read more or re-look at this again before the recording comes out tomorrow, take a look at the chapter called Brain and Nerves. And then take a look at this article I have written called Neuropathy Repair, Heal That Tingling, Numbness, and Pain. I could have even said burning as part of that. Tingling, I think, is itching. Okay, but this has the comments in it that I just described to you. Okay, all right. Let me go back here. All right, very good. Good luck to you. Hello, Deb. Let's see. Hi, Dr. Ross. I'm using nebulized glutathione. I notice when I use it, I will get a loose cough that calms down pretty quickly, especially if I haven't done a treatment in a while. Do you know what causes this? Any need for concern? So glutathione, we just talked about that, okay? So sometimes to increase the chances that it gets absorbed, one way to use glutathione is to nebulize it, which means to breathe it in using a machine called a nebulizer. And what a nebulizer does, you pour your glutathione liquid in a small chamber. This nebulizer uses an air compressor that blows air through a tube that goes over the top of your glutathione, causing it to turn into a mist. And then there's a mouthpiece, and you breathe that deep into your lungs. And inside the lungs, so the blood vessels in the lungs, the glutathione then is absorbed into your bloodstream. Okay, so it's a good way of getting it directly into the blood. Now, when I had somebody do nebulizers, I would nebulize a person. Either they would do 200 milligrams up to 400 milligrams twice a day. Okay, when you start getting at the 400 milligram range, for many people, it can be very irritating. It's a side effect. It's an irritating side effect to the lungs, causing you to cough, okay? And it has to do with the concentration. It becomes more of an irritant the more concentrated the liquid is. So I used to have it mixed up, so it was, I think, 200 milligrams per milliliter, and I would have people use this liquid that they'd use 2 milliliters, which would equal 400 milligrams. And if the 2 milliliters was too irritating to them, I would have them get some distilled water and add 1 to 2 milliliters to this liquid. This 2 milliliters they already had in there. I would dilute it by a half and then have them nebulize it, okay? And when you dilute it, that makes it less concentrated. Therefore, it's not going to irritate your air pipe as much, all right? So it's a side effect. There's no reason to be concerned about it other than it's irritating you. And the thing to do to it is to add a little bit of distilled water to dilute the liquid. Okay? All right. Good luck to you, Deb. All right. Actually, I'm going to do another screen share here because I think I may have even described that in one of my articles, but let's go back here. All right. So back at Treat Lyme again. So if you're wanting to find, I have written an article about glutathione. And actually, let's Google it here real quick. Or I'm going to search my website for it actually. Okay. So the article I've written is called Glutathione, the Great Fixer. Okay. And that image there is actually the chemical structure of what glutathione looks like. And so in here, I describe all the things glutathione can support. One is liver detoxification. The other is it can help decrease Herxheimer reactions. It can help with nerve and brain repair. It can help with liver repair. And then there's different ways you can get it in you, but one of those I describe is the nebulizer. Another way is the IV glutathione. And then also there is this liposomal glutathione that I was telling you about. Okay, so if you want to read more, here's the whole article on that. All right. All right. Good luck to you, Deb. Thanks for that question. Hello, Lynn. Hold on here just a minute, everyone. So are persister, hi Lynn, so this is Lynn's question. So are persisters another word for cyst? What is your opinion on bee venom and also organic whole leaf stevia powder? Happy New Year. Happy New Year to you too, Lynn. All right, so let's talk about persisters and cysts first, okay? So persisters are something, a persister is a state that both spirochetes and cyst form of Lyme can take, all right? So it is not another word for a cyst, but is rather a state that some cysts can take and a state that some spirochetes can take, all right? So let me describe what I mean by that. All right, so what happens when Lyme is exposed to antibiotics for a while, and that's the spirochete and the cyst form of the germ. There's been some experiments, some petri dish experiments that show that about 20% of the spirochetes and 20% of the cyst will turn into a persister forms, or I'm sorry, take on a persister state, okay? Become persisters. And so what a persister is a form of a spirochete and a form of a cyst that basically goes into hibernation. It slows its metabolism way, way down and basically starts ignoring the world around it, including the antibiotics. It just ignores them. The antibiotics can't touch it, okay? And so what they were able to show, the one piece of research that demonstrated this was some research conducted out of Northeastern University in Boston. Yes, Northeastern University in Boston. Getting my Westerns and Easterns confused here. But Northeastern University in Boston, and I think it was almost 3 years ago now, that they showed that when Lyme was exposed continuously to ceftriaxone, an antibiotic, on a petri dish, that 20% turned into the cyst and 20% of the spirochetes became persisters, okay? Now, what they also showed in that same experiment, though, is if they did a process of stopping the antibiotics long enough so that they could see that the germ woke up, became active again, the cyst became active, and the spirochetes came out of the persister state. Then if they reintroduced antibiotics again, and they did that process of starting and stopping 4 times, they could eradicate all forms of Lyme, get rid of all of it, okay? And so that's why some people have taken to doing pulsing of antibiotics, okay? That's one reason to pulse antibiotics. Pulsing doesn't always work, okay? But that's where the rationale for that came from, okay? Now, in terms, again, I talked earlier tonight, Lyme exists as a spirochete. Lyme exists in a separate form called a cyst form. Cyst forms also are the same as what people call a round body, which is the same as what people call an L form, okay? So if you see the word cyst, round body, round forms, L forms, that all pretty much is saying the same thing. I call those cyst, okay? All right. All right, bee venom therapy. So bee venom, there's not much research, I would say, in the world of Lyme about bee venom, but there is some suggestion that what bee venom can do is be anti-inflammatory. So, and maybe help the immune system work better too. What I have found, and I've never recommended it for a patient of mine, but I've had patients that have tried it before, and they had mixed results. Some people had really good improvements with it, and some people not. It's one of those things you try, but I can't guarantee that it would give benefit, okay? All right, and then in terms of stevia has turned, I think, is one of the greatest disappointments. That may not sound like a good thing to say, but let me tell you why. So there was some really promising petri dish research that came out about 2 or 3 years ago now. Eva Choppy, her name is spelled S-A-P-I. If you Google Eva Choppy stevia, you will find her research, okay? And she's done a couple of different articles. One piece that showed that stevia can remove biofilms. Another one that showed that stevia might be a useful treatment for persister cells, okay? And they looked good on petri dish experiments. I got to admit, her experiments look really good. The trouble is, a petri dish is not a human. All right. And the dynamics and the environment on the petri dish are very controlled, but we're a different thing altogether. We're a different laboratory. Okay. And I think what happens is I worked with stevia based on those experiments. I just didn't see anything really happen for most, probably 99% of people. And I think what the issue is, I just don't think it gets absorbed in a way into the blood that is meaningful or high enough concentrations to do anything. So although it looked promising in a petri dish, all right, that's what I mean by it was a disappointment. It just, in the practice of medicine, when I was using it, I just did not see much benefit, okay? So it's not high on my list of things to recommend that people try, all right? All right. Good luck to you, Lynn. Thank you for that question. Oh, so I think many of you know stevia is a plant that has a sweet but a strange aftertaste to it too. So it's used as an artificial sweetener, all right, with an aftertaste. Again, Dr. Chappie's been looking for things that she can try for Lyme, and she happened upon that. Who knows? Maybe there'll be a way of getting it delivered into our bloodstream that she'll develop, but I just don't think it's adequately absorbed. All right. Hello, Susan. Hi, Dr. Ross. Please speak about elevated liver function test, elevated calcium levels while taking antibiotics, and some of your herbal supplements. That's a pretty big question. I'm not sure if I'm going to be able to answer that without, I'm not clear what you're asking for. So, well, actually, I'll try to answer what I think you may be asking, okay? Hold on here, man. I'm really thirsty tonight, just a minute. Okay, so liver enzymes are also known as AST and ALT. Or they also go by another name called SGPT and SGOT. Okay, but yeah, usually these days they're more or less called ALT and AST. And these are enzymes made inside of liver cells. And if they become elevated, they're a sign that the liver can be inflamed. Okay, so now certain antibiotics can inflame the liver. And the ones that we use in the world of Lyme, the ones that generally have a greater chance of inflaming the liver is rifampin and rifabutin. Also the azoles, which would be metronidazole, also known as Flagyl, or tinidazole is another one that can do it too, okay? Also in the world of Lyme, sometimes we use anti-seizure medicines to help control pain like Lyrica or gabapentin. Those can inflame the liver. Sometimes if you happen to be using sleep aids like benzodiazepines or, usually benzodiazepines, they sometimes might even increase liver enzymes as well too, okay? So yes, certain chemicals can increase liver enzymes, all right? Now, my practice when I was seeing patients is I found I was comfortable as allowing people to have elevated liver enzymes as long as they didn't become too elevated, okay? And so one of the problems if you have continuous ongoing liver inflammation is over years, that might lead to scarring of the liver. That's something called cirrhosis. Okay, so you want to avoid that, all right? So my standard was to let people use medicines without necessarily taking them off of something, as long as the AST and the ALT were kept within 2 times the upper end of the normal range. Okay, so what do I mean by that, right? So when a lab gives you your ALT level, for instance, the lab is going to tell you what is the normal range for that lab, and they might say it's between 20 and 40, okay? So in that case, the upper end of normal is 40, and I would be okay, therefore, letting somebody go up to 2 times that, which would be up to 80, okay? So on that test, I would be okay if it was 80 or less, all right? All right. Now, if you start getting elevated liver enzymes, what you can do is help your liver to deal with it, though, all right? And that is to use glutathione, all right? I talked about glutathione earlier tonight, that it's the great fixer. And one of its biggest things, the reason that it's made is to help repair injury, all right? Also keep in mind, in the liver, it's used to help do detox as well, too. The liver, that's the main detox chemical in the liver, all right? So if you've got elevated liver enzymes coming from your medicines, one thing to do is to add in 5 milliliters of a Trifortify that I was talking about earlier. I'll show you that here in a minute, okay? All right, then in terms of herbal antibiotics, can herbal antibiotics elevate liver test? In theory, yes. I gotta be honest with you though, I have not seen that occur in my practice, all right? I will tell you though, we're all very unique laboratories, and just because I never saw that doesn't mean that it can't happen. But that is just something that I had not seen occur on herbal antibiotics before in my practice, okay? Regarding elevated calcium levels, I have not seen that occur with antibiotics. Now, what I would do if your test came back showing elevated calcium is I would want to go ahead and research each of the antibiotics you're on and see, are those side effects that have been seen on that specific antibiotic that I'm just not aware of, okay? I mean, there's a lot to remember in medicine, right? But I have not seen elevated calcium be due to an antibiotic before. I'm not saying it's not possible. I'm just saying I haven't seen that occur, okay? All right. I hope that gives you some useful information. And again, take a look. Well, actually, I've talked about it a number of times here, so I'm just going to show everyone something here. All right, so this is my supplements. Right? This is Marty Ross MD supplements, and anyone can purchase from here. Okay, so this isn't just for people that used to see me in my practice, but this is for anyone. All right. So in terms of the glutathione product that I have worked with in my practice, and I've talked about a couple times here tonight, is I like this product line called Trifortify, okay? And this is all by Research Nutritionals. They have, for instance, this is their Trifortify Orange. They have a Trifortify Watermelon. But if you're wondering what I've been talking about, this is what I've been talking about, okay? All right. All right. Thanks, Susan, for that question. Good luck to you. All right. Hello, Michelle. Say hi, Dr. Ross. I've been trying to treat my Lyme for about 2 years now. I've been taking 200 milligrams of Doxy, 100 milligrams of grapefruit seed extract, a probiotic, and vitamin D for about a month. The neuropathy that started a year ago is starting to get better, and so are my energy levels. The neuropathy and muscle weakness is scary. Will it ever go away? My aches and pains are better some days, but never really go away. My main issue besides the neuropathy are my feet and severe neck pain. Am I on the right track here with the protocol and any suggestions for the neck pain? Is there anything else I can do? Is it dangerous to exercise with neuropathy or try to build back some muscle strength? Thank you, Michelle. All right, so just about the exercise, I've got some ideas for you to consider too, but just about the exercise, okay? Exercise is great. However, if it makes you worse, it's not great, okay? So the key with exercise for your muscle strength and your neuropathy is to find a level you can tolerate. And it may just be 5 or 10 minutes of walking a day, for instance, okay? You just got to be careful not to overdo it. So the guide is if you're worse the next day, that degree of exercise you did was too much, okay? And as you recover, hopefully you'll be able to start expanding the amount of exercise, but you got to be careful not to overdo it, because if you overdo it, you may injure yourself and you may even suppress your immune system to a degree too, okay? All right, now, I think you are on the right path. I mean, clearly you're getting some improvements here, okay? So the Doxy grapefruit seed extract mix, Doxy is good for treating spirochete Lyme. Doxy is also good at treating Lyme inside and outside of cells, okay? All right. The grapefruit seed extract is a good, at least according to Petri dish experiments, breaks apart cyst. Clinically, I thought it was successful at doing that as well too, all right? So you've got your germ covered, all right? Probiotics are good. You're protecting your good bacteria in your gut. Vitamin D can be helpful too, all right? But there's some things you may want to consider. So your neuropathy and your pain suggests that you've got cytokine excess, all right? So whenever you have Lyme, one of the main symptoms or one of the main reasons you have Lyme symptoms is that your immune system is overproducing a group of chemicals called cytokines. All right. Cytokines are good and bad. On the good side, white blood cells, when they see a germ, make cytokines, and cytokines cause more white blood cells to be made to fight infection. They draw those white blood cells where the infection is, and they help those white blood cells work better. All right, so that's all good. All right, in the right level, that's good. The trouble is when the immune system isn't doing a good job getting rid of Lyme, and often it doesn't, it tries harder and harder, and eventually it makes too many cytokines. All right, and too many cytokines give you the host of what we call Lyme symptoms. All right, so too many cytokines make it so you can't sleep. They make it hard to think. They give you fatigue. They make you hurt all over. They give you inflammation of your nerves, etc. All right. And too many cytokines, rather than helping to boost your immune system, suppress your immune system. All right. So one thing I would do, the neuropathy especially means your nerves are inflamed. So I would probably, if I was seeing you as a patient, if you were to see me, and I've seen patients in situations like this, I found benefit by having them take curcumin. All right. Curcumin comes from turmeric, the seasoning turmeric, and it's very strong, very useful at lowering cytokines. Okay. All right. And so what I would do is you want to do a liposomal variety of that. Remember, we talked about liposomal glutathione tonight. You want to do a liposomal variety of curcumin to help increase its absorption, because curcumin is not well absorbed, okay? But if you use liposomal variety, it is. And you want to take 500 milligrams 3 times a day, and that's a good support for lowering inflammation and lowering cytokines in your body, okay? So number one, liposomal curcumin. I like using a product by Thorne called Mariva 500 for that, but 500 milligrams 3 times a day. That's number one. Number two, you want to start repairing your energy factories in your cells called mitochondria. All right. So when you have chronic infection, and it's been going on for years like yours has, that chronic infection causes the immune system to overproduce another group of chemicals, which are called oxidizing agents, okay, which is the opposite of antioxidants. And oxidizing agents damage fat membranes. So they damage the membranes of your nerves, which is a double layer of fat. We talked about that earlier tonight, okay? But they also can damage the cell energy factories, the membrane that makes up the cell energy factories. Those are called mitochondria. And if your mitochondria get injured, you're going to have extreme muscle weakness sometimes, all right? You're going to have fatigue. You're going to have nerves that have a hard time healing because they don't have enough energy, all right? And the same things that you need to do to repair the mitochondria will help repair the nerves as well too, okay? So step one of repairing mitochondria and nerve injury is curcumin to decrease inflammation. We already talked about that, okay? Second step I talked about earlier tonight is glutathione. That Trifortify product I suggested, or liposomal variety, helps to increase glutathione in cells. When I'm talking nerve injury or mitochondria injury, 5 milliliters 1 time a day. Okay. Next step you want to be on, I talked about this earlier with nerve repair, is get on that NT factor. NT factor, 2 pills 3 times a day for 2 months, then 1 pill 3 times a day for 4 months. Okay. And that kind of formula helps to repair the mitochondria membrane, helps to support repair of the nerve cell membrane. It's something I found useful in my practice in Seattle when I was using it. Okay. All right. That's kind of your minimum package: curcumin, glutathione, NT factor, okay? The other things that you might want to consider if you are vegetarian, not having red meat at least a few times a week or twice a week or so, you may want to get on something called acetyl L-carnitine. Carnitine is the transport vehicle that helps carry fat to the inside of mitochondria. And your mitochondria use fat as one of their sources to create cell fuel, all right? So if you can't get the fat to the inside because there's not the transport vehicles, your mitochondria can't generate energy so you can heal. You won't be able to heal, all right? So if you are vegetarian, I suggest acetyl L-carnitine. Thorne makes a product called Carnitil, is their variety of acetyl L-carnitine. 500 milligrams twice a day for 1 month, and then decrease it to 500 milligrams 1 time a day, okay? And that the other thing you might consider adding to that too, the last thing, if you have resources to do it, because I know this all gets very expensive, that can be helpful is to be on something called coenzyme Q10, 400 milligrams twice a day, or it's also called CoQ10. CoQ10 helps carry electrons around your mitochondria, and the electrons help create cell fuel as well too. Okay, all right. All right, so yeah, those are some thoughts. I'm going to show you some articles that you can take a look at later, and which has this information in it as well too. Okay, all right. Good luck to you, Michelle. Let me show you that article here, or those articles here first.